Hello, everybody. I'm back. I'm here at ISCT 2025 in New Orleans, and I have met a friend. Her name is Heather, and she is with BioBridge Global Advanced Therapeutics, Advanced Therapies. Advanced Therapies. Okay, and you're based out of San Antonio?
That is correct.
And she is doing something really special this year at ISCT, and they are announcing a new program out of their center, and I thought maybe she should introduce it to us. So what's going on?
Yes, my name's Heather Munoz. I am a registered nurse, and my role at BBG Advanced Therapies is Principal Global Market Development. So I'm in sales and marketing, overseeing the cellular starting materials. So we do leukapheresis, which is pointed this bus here, which I'll go into, and also cord blood as well, and we do clinical research support. And that's only some of our services that we have too. We also have biomanufacturing and advanced testing for our cell therapy product.
I haven't seen a bus on a floor at these shows recently, so this is a really unique program. Tell me a little bit more about the program.
This is the world's first fully integrated mobile leukapheresis center. The point of this is, big bottleneck in our healthcare system is not having access to care. So we're trying to be innovative here and put everything on wheels. And one thing that we haven't done is put a leukapheresis machine on the road before. We're able to bring those machines into hospitals. They're able to be moved, but we haven't put them on a bus where we can move the actual bus to the patients. This is a great innovation. I'm excited as somebody who's been in apheresis centers, started them. It's a long process, and if we're able to bring it to those patients in rural areas, then this is a huge barrier to care, right?
A lot of people talk about patient accessibility, but you guys actually did it. Hello, bus. It's brand new, right?
Yeah, we just got it last week. This is our first one. We have our second one in the works already. And I think what's great about this too is that, we're going to be in San Antonio, Texas. That's where we're based out of. That's our home base. Texas is huge. It takes several hours to fly over. And there's really not a lot of centers in Texas, not outside of Dallas and Houston and Austin. So what is the best thing to do is to take the bus down the Rio Grande and to help those patients down there.
Yeah, and meet them where they are. And this is for both donors and patients?
Yeah, we're doing both donors and patients, allogeneic and autologous collections. So.
Oh, that's amazing. We're going to get a chance to see the bus in a minute or two. And if you're not here at ISCT, you're also going to get to see it at
ASGCT.
ASGCT here in New Orleans in just a couple of days.
Yeah, we'll be back.
Let's take a quick tour of the bus. Is that cool? Should we do it?
Yeah.
All right.
Welcome to our mobile leukapheresis center. Come on in with me. First stop will be where we do actually our patient and donor collections. We have 2 leukapheresis machines, so we can do 2 patients at a time. Typically, these collections can take anywhere between 4 and 8 hours. So we want to make sure we have these nice reclinable beds for them. And we also have some entertainment as well. They might have to fight over a movie, but that's okay. So we'll have 3 people on the bus. We'll have an apheresis nurse. We'll also have an apheresis tech and phlebotomist. And then we'll have somebody driving the bus too who will be a jack of all trades who can do it all. Come with me. We also have a bathroom, which is super important, right? These patients are going to be doing collections for several hours, so we want to make sure that they're comfortable and can use the restroom. So we do have temperature and humidity monitoring all throughout the entire place, so we want to make sure that everything is GMP compliant. We do have 1 fridge here for donor snacks and drinks. This is our workstation. We got a nice bench for you to get all comfy before you go onto the bed. And then this is the lavatory. It's so exciting. So we already have our Sysmex on board. So we'll be able to do CBCs on our patients and donors before they go on the machine and after. And also we can do it for our product as well to make sure it hits counts before we box it up and send it out. Very modern, very cool. It's very spacious too, which I think is super important. And it takes away kind of the scary, white walls that typically you see in the hospital, right? Awesome. Since we're in San Antonio, Texas, we have a lot of Spanish-speaking individuals. So we have made the bus in Spanish. And then on the other side is also in English too. So we got lots of storage on this bus. And we did drive this all the way from San Antonio too, which I heard was quite a fun, interesting ride. Yeah, so as you can see, all of these different flowers, they're part of Fiesta, which is a very important event that happens actually in San Antonio to celebrate the culture from Mexico and all the surrounding Hispanic communities. So the bus does have 2 generators, and then it can be plugged in as well. There's stabilizers to make sure that, if we're on a slant, that everything will be level, especially for our equipment. That's very important. And we also have Starlink on board. We have internet. We can stream too, better than on an airplane.
This bus is extremely modern. You put a lot of thought into making sure that not only is the program accessible for the patients and the donors that are going to be part of this, but that everybody has a really good patient experience. So I thought we would just do a little quick lightning round on a couple of key topics. Would you like to do that?
Yeah.
Okay, let's do it. First word that comes to mind when you hear cell therapy.
Lack of patient access. I think patient access is the biggest problem, right?
She says that because there's a big bus behind me and it's totally accessible now.
Advertise it, right?
Yes.
So this is a huge bottleneck. I'm an apheresis nurse and oncology nurse by trade, and there's always been a huge gap in logistics, right? Trying to get the patient to leave their family, leave their hometown, leave their house, and go get an apheresis procedure where it's just a simple procedure. Typically, there's no side effects, and then they have to stay in the hospital, which is no fun. It's hard for patients that are pediatric patients and also their families as well, and adults. And then on the other end too, vein to vein. I mean, we also have this issue with infusion too. They have to travel hundreds of miles away to get their cell therapy infusion. When it's also generally pretty safe when you get it infused, it's usually just the aftercare that is the issue.
Next question, more exciting. Autologous or allogeneic?
And so I did work for a biotech in allogeneic, which I thought was very exciting. And I think that access, right? So autologous is really hard on the patient. Mm-hmm. They have to come in, they have to have their cells collected. And depending on the indication, they usually get growth factor stimulating hormone. So they have to get injections for several days, which can cause some bone pain. And it's a very, very big process for them. You know, they're already not feeling well. They probably just got out of the hospital. They were getting chemotherapy. They live hundreds of miles away. If we were to eliminate that and use a healthy donor to create an allogeneic program and hit hundreds of people, this is just like revolutionary.
Absolutely.
And we can have such a better outreach and really decrease that amount of impact on the families, on everybody, right? And also on the hospitals too.
All right, next one. What's your personal cell therapy superpower?
Okay, so I love this question.
Okay.
I think it's great. I would say my personal cell therapy superpower is I've been in several different roles. So I've been a nurse, right? I've been on the oncology side where I've seen cell therapy not be available to patients. It's a third line treatment. It really needs to be a first line treatment for it to be successful. Yep. So that's my superpower, understanding what the patients go through on that side of the vein, but I've also been doing apheresis too. So I understand the vein to vein process and where it gets a little convoluted. And then I've also been in biomanufacturing and worked at a biotech to see what the process is to go through all this, right? Yeah. It seems like such a little procedure that happens in the beginning, but there's a whole next step that needs to happen before it can come back to the patient.
How about this next one? One tool, technology, or idea that you think will change the game?
Definitely us figuring out the bottlenecks, right? So apheresis centers, also cell therapy institutions too, making sure we spread the word that really it's the access that we're having issues to. There's so many different things that we're working on that I think we need to really look and see what is the first thing that we need to focus on.
Yeah. One more, and this one's kind of fun. If cell therapy were a sport, what would it be?
I would say pickleball.
Pickleball, I love it. Okay.
I'm from Washington, so maybe that's why it was actually founded in Washington. Why I think pickleball, it's new and it's exciting sport, right? Everybody wants their hands in the pot. Everybody wants to play pickleball. They want to see what the field is like. But on the other hand, it's a lot of precision, accuracy, and teamwork. We need to work together to figure this out. So when you're serving and you're receiving that ball, you have to be very accurate, and you have to make sure that you play as a team in order for this therapy to be actually delivered to patients and for it to be successful. So,
well, thank you so much for the time today. This has been great to actually get a tour of the bus and learn more about everything that you're doing at BioBridge. So this is excellent. I'm very, very excited for you guys. So good luck.
Thank you for your time.
All right. Thank you so much.
Thanks.
Bye.
Bye.